This is Megaphone from Medvale Media, and I'm Dave Self. This is where we hand the megaphone to healthcare leaders to share their thoughts and perspectives and the occasional rant about the ever-changing and dynamic world of healthcare. And today it's a privilege to welcome Dr. Joelle Powers, Dean of the College of Health Sciences at Boise State University. Dr. Powers, welcome to Megaphone. Thanks for joining us.
Hey, thank you so much for having me, Dave. I'm excited to be here.
Well, we're excited that you could make time to join us as well. First, congratulations on being named Dean of the College of Health Sciences at Boise State University. You're not new to BSU, but you are in a fairly new role for you. So maybe share a little about your background and your path to where you are today.
Sure, I'm happy to do that. And thank you, by the way. It's a privilege to get to be in this new role. I have been at Boise State since 2012, and I came here from UNC Chapel Hill. I started in the School of Social Work and then moved into my associate dean role and was in that position for about 7 years, and then was appointed dean of the college July 1st. So it's still, even though I've been a part of the college for a long time, it's still a steep learning curve to learn the role. But my gosh, I get to work with great people doing good work all the time. In terms of how I got here, I probably had a little bit of an atypical path. I knew when I was young, both my parents were public high school teachers, and I knew I wanted to work with kids, but I was pretty sure I did not want to be a teacher because I watched them bring home stacks of grading. But in college, I had the wonderful opportunity to go to Africa, Zambia and Zimbabwe in between my junior and senior year. And it was, looking back, such an incredibly pivotal experience. At that experience is where I decided whatever my job is, it's going to be working on issues of social injustice. And came back and thought, my gosh, I still don't know what I want my career to be. I'm going to be a senior in college. So I thought, I better bump up my GPA just in case. So I took an intro to social work course, having no idea what social work was, but I heard the instructor was an easy A.
That's a bold move and a smart move.
Bold move for someone who then goes into higher ed. But my gosh, that instructor really changed the trajectory of my career. And from then on, I went into a master's program and later a doctoral program, and social work just became a profession that grew into a love of healthcare and wellness. And so it's an interesting route to get to higher ed, but I am so thrilled that it got me where I am.
How fun to hear about this path that you've taken. And the time in Africa had to be really pivotal, as you say, something that really impacted you to want to pursue something around social justice.
Yeah, I would say I'd never seen poverty in that way, to that extent. And it's the first time I think I recognized how privileged and blessed and frankly lucky I was to be born and raised where I was in the family that I was. And that plus the class was just a major turning point in my life.
Truly so much we take for granted, but thanks for sharing that with us.
Sure.
Can you give us a sense of the college by the numbers, just an overview of maybe the number of students, the types of degrees,
Sure.
and distance learning, if that's part of the curriculum?
Yeah, absolutely. So it's been an interesting course of growth for the College of Health Sciences. We are now the second largest college on campus at Boise State, and our predicted growth looks like we will be the largest. We have about 5,500 students in our college, which is the same size as some smaller universities. We have the single largest graduate program on campus, which is our online Masters of Social Work program. Last summer, we graduated our 1,000th student.
Outstanding.
It really is incredible. We have a national footprint. Right now, we have students in all 50 states through that program. And we have several. But in terms of the other kinds of programs in the college, we have nursing, social work, public health is now one of our larger schools. kinesiology, radiologic sciences, respiratory care, genetic counseling, counselor education. It's a diverse group of disciplines that all fall under the umbrella of healthcare. So, and I would say we are now leaders on campus in terms of online learning. And we just have some incredible partners that we work with through Boise State that help us do this well. One thing we talk about a lot with our faculty is, as a faculty member, you are the content expert, but we have this wonderful collaboration with what's called extended studies, and they are the experts at how to transform that content expertise into an online platform. And so it's just been, I think it's translated into access for students to earn degrees who otherwise wouldn't. When we first launched the MSW program, our first cohort shocked me because half of the students were in Idaho. And we were not expecting that at all. We thought it would absolutely be other states or very, very rural places. And what we found was we were serving folks who were caretakers, whether it was to someone aging or to children. We were serving folks in the military and their partners. We were really providing an education to folks who weren't going to be able to get it in a very traditional model. So it's ever changing, right? I think when we started in social work, not a single faculty member had ever taught a single course online. And so it was a steep learning curve, but the impact is really incredible.
Well, your comments lead to another question. It seems as though you might be fulfilling a need for people in more rural areas that don't have access to campus. Obviously, if half the students in the first cohort were from your own state,
Yeah.
and that was not expected,
Yeah, not at all.
fulfilling maybe an unmet and unseen need.
Yes, and I would say what's interesting is the president of our university, that's really one of her kind of passion points, is serving rural areas. And I think when we started up the program, we didn't even know that that's to the extent to which we'd be able to help do that.
How do you determine which degrees to offer? What's most important for the healthcare industry? Because you touched on kinesiology
Yeah.
and radiology and all the other areas within the college. How do you determine which curriculum to put forward?
Yeah, that's such a great question. I think what comes to mind is probably two primary ways. Right now, all of our departments or schools, every one of our units in the college, they each have their own version of an advisory council. And that advisory council is made up from experts and leaders in the community who are working in the field. And it has been, sometimes it's a little impact, but they get together at least twice a year, sometimes four times a year. And this group often works directly with our current students. And we have this opportunity to say, hey, where are our students? Where are they successful? And do you see gaps in their training? And we've had really explicit feedback that then directly impacts our curriculum, because our goal is let's graduate students who are ready to hit the ground running and be successful. And we have this generous group of experts who can come in and say, no, this is what's changing in the hospital. Your students need to be ready for this. And so for each of our departments to have that group of leaders who will generously weigh in definitely impacts our programming. And they are the ones to say, hey, have you thought about this? Here's the gap for us in terms of our hires. We need someone to do this. I'll tell you, it was a direct comment from one of our nurse leaders here in the area who said, we have had two positions for genetic counselors open for more than 2 years. We cannot hire. And that was the beginning of us. We didn't have anyone on our faculty who had that area of expertise. That was really the beginning of us starting to think about we need to move in this direction. So that's one way, having people in the community who will weigh in. The other is the university has started partnering with a company that does market research on this. Where are the educational needs? Where are the needs for communities for hiring? And how can we match that up? And so we've gotten reports. To be honest, the Masters of Social Work degree, that idea did not come from inside the School of Social Work. I wish that
Really?
I could say it was our idea. It
That's okay.
wasn't.
You can take credit for it. Don't worry.
It was someone else coming in and saying, hey, there's a need nationally for this, and there's a desire for folks to earn this degree. And that was really what sparked the interest and the figuring out the feasibility of that.
Again, it seems as though you're fulfilling maybe unseen and unmet needs with a variety of different inputs and different folks leaning in. It sounds as though these advisories are people in the industry, obviously. If
Yes,
a nurse leader was giving you
yes,
insight as to what was really required.
absolutely. And so we have a mix of um, practitioners and leaders in each of those advisory councils.
It does seem lately, though, that public opinion has been questioning the value of post-secondary or higher ed um, education training, uh, even leaning more in some areas toward certificates versus
Yeah,
four-year degrees.
yeah.
What's the situation at Boise State University in the College of Health Sciences? What's that vibe like for you? Are you challenged
Yeah.
by that? How do you recruit students?
It's interesting. We face probably some different challenges than other institutions of higher ed. I mean, you look in the Chronicle of Higher Education, and schools and colleges are closing every day. And the return on investment is not as clear, I think, to the larger community. And that has, I think, resulted in a decrease of student interest in going to college. Um, the College of Health Sciences has not faced that, and frankly, Boise State has not either. We are continuing to grow and we are increasing graduation rates. It's really amazing. I think our president gets asked to go and speak at conferences all the time to talk about how that is happening. But for our college in particular, I think a major issue for us was COVID and really not having a sense of how that pandemic would impact people's potential interest in a career in healthcare. And so we kind of were braced to watch our enrollment, to think about things differently. And we have just continued to have a desire from students, and I would say their parents or their families, um, for them to come and earn these degrees. If I had to speculate as to why, right? We don't, as a college, have any hard research on this. I think one thing that is reassuring is there's a very clear pathway from degree to career, right? Like if you are a nursing student, the career is easy to picture, it's tangible, and it's very direct. Um, and that's, I think it's tougher for folks to get behind when that pathway is not quite as clear. So for us, it's been, yeah, growth and really trying to manage growth. And right now, there's more desire than capacity, and a major. But we get asked all the time, why don't you accept more students? And the truth is, it kills me to turn away qualified applicants, right? Like that's
Sure.
devastating. Um, but we are limited by clinical placements. So our students cannot graduate with most of our students cannot graduate with an accredited degree unless they've had a specific number of clinical hours in a rotation, and that takes really, really lovely partnerships and investment with our stakeholders, because really our hospitals and our agencies, they take our students and they train them, and that helps us to graduate them. So that's a limiting factor for us, but I do think health sciences is unique even on our own campus.
It's an interesting problem, challenge that you have. So your partners aren't able to accommodate all of the students in a way that puts them in a clinical environment during their training. Is that Is that what we take away from your comments?
Yeah, and the clinical environment is very, very, specific. And there are a lot it's not at all loose. It's very regimented actually what kind of counts as a placement. We have to have an affiliation agreement, a legal document signed between both entities. There's just kind of a lot of stipulations that stem from the accrediting bodies for each of these disciplines.
Okay.
But my goodness, we are so grateful for our community partnerships and the folks who will work closely and essentially train our students. That is what sets these students up to be successful when they graduate.
Well, you can imagine that your partners are grateful as well to be able to train those students and then have first crack at them when they're ready to
Yes.
start their careers. So a good
Yeah,
pipeline talent directly
it
into
is
your
a
partners.
lovely reciprocal relationship for sure.
Symbiotic relationship.
Yeah.
In your career, you've experienced the many changing needs of healthcare. Curious from your perspective how emphasis on public health and in the last decade or so, population health
Yeah.
have helped shape the emphasis at the college and even the curriculum.
Yeah. It's interesting. I think probably even as recently as 5 years ago, the phrase social determinants of health was not something that was common to a lot of folks. And that is now something that our students are taught across the curriculum, across every program. I mean, thinking about systems and the way systems shape whether some of our disciplines say clients, some say patients, but the massive impact on current situation and predicted outcomes is really an incredible shift in the way we think about um, treatment and intervention. There is such a new emphasis, and what I should say is more of an emphasis on prevention, which is really cool. Something I can say that we see in our curriculum is we have multiple programs from other disciplines who have their students take public health courses in our School of Public and Population Health. Like it's now considered foundational for so many of our degrees. And so that's been a big shift. Absolutely.
And there's not a teaching hospital in Idaho. So there's also a bit of a limiting factor, I would imagine, there as well as to how you view degrees and
Yeah.
impact of public health, population health, what that really means
Yeah.
in the market.
Absolutely. And we have a couple of degrees that really are the launching pad for student. We often call these students pre's, our pre-med, our pre-dental, our pre, right? Like we have these degrees, and public health is a very popular degree for folks who know they want to go on. But yes, if they want to be pre-med, they're applying elsewhere.
A frequent topic with our guests is professional burnout in the healthcare industry, not just among physicians, but all care providers. And the pandemic certainly amplified that, but there is a lot involved in that today. The administrivia that many providers have to endure in the course of doing their job. It's not patient facing. It's taking care of electronic health records. It's looking at other information to make sure that the time with the patient is the right amount of time and discussing the right things, checking boxes in a system. So this burnout tends to be something that rises to the top of healthcare executives'
Yeah,
concern list.
sure.
Is there a way, or are you finding a way to include resilience as part of the curriculum? And so maybe preparing your students for what they could face when they start their careers.
Yeah. I think we've talked about this quite. And I need to be careful because I certainly know social work better, right? Because it's my own background.
Yes.
But for a long time, part of the curriculum has been self-care when students are in their undergraduate degree or their master's degree. And really the framework for that is understanding that you are going to be working with folks in on their most vulnerable days. and that is right. You are giving, and that is depleting, and that you actually can't give if you're depleted. And so we talk about that in a lot of ways. The ways I've seen it, and that is now across our curriculum and our programming. We talk about self-care and resilience all the time. Um, I I don't think it's ever been as stark as COVID. And so that, right, like our students saw that, they watched that, whether it was on the news or just hearing statistics of the number of folks who left their roles in healthcare. So that's always an anchor that we can go back to that is very tangible to our students. Um, but we have things now like physical spaces in some of our buildings that are self care rooms, that is a quiet space with whether it's quiet music, and a couple of them have like a small water feature and a massage chair that someone can sit in, but it's a
Oh,
room that is
hey,
really just
we all want to go back to school now.
I know, and they're usually very small, and the lights are dim, and it is, I think, helping students recognize, and actually what I love is it's every bit as available to faculty and staff as well, but it's a chance for someone to go in and tag out and mentally regroup for a minute. And it's just a great example for our students of what this can look like, because certainly self-care can look different for all folks, but we talk about it a lot.
For a very long time, mental health was not something that
Yeah.
polite people discussed, and it
Yeah.
wasn't a public conversation, but it is today,
Yeah.
appropriately so. And we do hear and read more about the mental health challenges of students at the university level with the pressures of the cost of education,
Yeah.
the rigor of the curriculum, uncertainty of the market for their future careers.
Yeah.
Um, is that something that you all are able to address? It sounds like you're touching on it with these safe spaces where they can step away and just get their head together a little bit, decompress. But is there another, or are there more programs that you're developing or in place around mental health for students?
Yes, absolutely. So we have a health services unit on our campus that is for students, faculty, and staff. We primarily serve students, and we have an entire floor of one of our larger buildings is essentially a clinic, and it's medical services, health services, but a substantial portion is mental health and behavioral health services. Um, One of the most uh, heartwarming things I think I've seen on our campus in a while. I think it was 2 years ago. Anytime student fees are increased on our campus, it goes through a student governing body, right? The students actually get to vote on, and we have student leadership. What should we spend our money on, and whether or not they want their fees to be increased? And the students decided the number one need on our campus is more mental health services. And they had folks from our health services unit come in and give a presentation on wait times, and how long, once a student contacted saying, I need support, how long they had to wait to get an appointment. And I believe we hired on campus 6 more mental health providers by the next year, because students said, yep, it's worth raising our fees. We want the money to go there. So we have all kinds of individual services, group counseling for students. But I mean, you're right, Dave. The number of students coming onto campus with anxiety and depression are the top two, but who need ongoing support, let alone students who come to campus. And it's, for so many, if you've moved away from home, it is a life transition that I think we underestimate sometimes. And now we have those resources on our campus. I don't think anyone at Boise State would say, we have enough, we have it covered. Like, we're always looking for ways to better support students. But something that makes me happy is these conversations around campus, really, because it's not just students, campus behavioral health and wellness and well-being. This is so normalized to have this conversation. It's so common. to talk about, hey, this is a priority. How do we do more?
Sure.
Whereas 10 years ago, this was new for us or newer for us.
That's a pretty fascinating insight to the minds of the students that are providing the guidance. Really, the student becoming the instructor in that case and saying,
Yeah.
"Hey, listen, this is what we really need,
Yeah.
and we know that there's a cost, and
Yes.
know that it's worth it for
Yeah.
us. So
Yeah.
we're willing to increase what we pay, but
Yep.
make sure you're getting us the services."
Yeah. Yeah. It was very powerful.
I believe too that the health services that you referenced are in your portfolio, correct?
They were up until July 1st. They're
Okay.
now, it's very typical for health services to be under student affairs. And it actually was maybe 7 or 8 years ago. And during some transition, the president asked College of Health Sciences to take it. But as of July 1, they're back in student affairs, but the partnership and the services to students are the same.
Well, Dr. Powers, when you look into your crystal ball, what are the top challenges that academic healthcare institutions have to be addressing to prepare students for their professions?
Yeah. I think one of the first thing that comes to mind that is unknown, that we are just not quite sure how to help our students be ready, is AI. And what will the impact of AI be in healthcare? And then, right, because we're right now figuring out the impact of AI on higher ed, and it is a massive mind shift for faculty and students. But it's just not quite clear enough for us to know, how do we serve the needs of our hospital stakeholders by training our students in the correct way. We just aren't quite sure yet. So again, I would say we're so grateful for those advisory councils and advisory groups, because that's the group in the front line in the hospitals and agencies who can say, here's what we need, here's what your students need. But yeah, that one's a big question mark.
Well, based on the conversations that we have with healthcare professionals across the nation, they don't have it figured out how to use AI yet
Yeah.
either. So
Right.
this is going to be a path that people have to go down together,
Yeah.
both your academic institution and the people doing the hiring after folks get their
Yeah.
degrees. So
Yeah.
there's not any magic answer today, and
Yeah.
there's so many ways that AI can be referred to and used. It's almost become that catchphrase that, well, it's AI.
Yeah.
And
Right.
what people don't realize is how deep artificial intelligence has been in different parts of our lives for many, many years, really since World War II. So
Yeah.
now it's really getting its moment in the sun through what most people are referring to as AI, these large language models that make it possible for folks to write a term paper without maybe
Yeah.
doing all the research.
Right.
Yeah.
Right.
Hopefully that's not the case at Boise State University.
Well, I hope not to.
Well, you get the last word. What would you like to leave us with today?
Oh, I guess first, just thanks for having me. What a cool opportunity to come and get to talk with you today. The other thing I would say is, we get an interesting mix of students who come to our college. Some who are very clear, right? And nursing is such a good example. Like, they come in with this identity of, I want to be a nurse. What I think folks don't know is there are so many opportunities in healthcare that people just don't think about, that maybe aren't as clear or as known as being a nurse. But gosh, there's just room at the table, and there's such a need, and we're just seeing ongoing predicted need in the future. And so I think it's a great spot for students to land.
Well, before we say goodbye, we always ask guests for some insider information. So, what should folks do when they visit Idaho? Give us one outside experience in the great outdoors and maybe a great dining experience to check out too, because I am taking notes on people's best dining experiences. Yesterday, we interviewed someone from the East Coast, and I now know where to go for the best steamed blue crab in Baltimore. So, why don't you give us some insider
Oh,
insight?
okay. Let me think. I, hmm. I think, gosh, if you were asking my husband, he would say mountain biking in the foothills, no question. That's his top favorite thing. I like to keep my feet on the ground. So I would much rather go on a hike or a walk. But I think being outside and the easy access to being outside is just lovely. For so many folks, it's skiing as well. I think for dining, oh, we are a house divided. I'll tell you that. We are not on the same team or the same page in this house, and I live with two massive teenagers who would say Sid's garage.
Okay.
Oh, it is just a great fit for them. When we go someplace as a family, everyone can agree on Wilder. Wilder's always a good spot. But I think one is not so hidden. My favorite spot to go for a drink, just because of the view, is the Highlander on the top of I'm blanking on the name of the new hotel.
Well, it's called the Highlander, and I'm sure folks can find
Yes.
it. So,
Yes.
okay.
Yeah,
All
it's
right.
just gorgeous up with that view.
Mountain biking, hiking, um, Sid's garage,
Sid's garage. It's an experience, Dave.
Wilder, and the
The
Highland.
Highlander.
Okay, well, thank you for the insight. We appreciate it very much. And thank you so much for joining us today. We're at the end of this edition, but join us next time for Megaphone from Medvale Media. Thanks for joining us. I'm Dave Self. Be well.